For those of you not familiar with SHOPS Plus, it stands for Sustaining Health Outcomes Through the Private Sector Plus and is USAID's flagship project in private sector health. The project is led by APT Associates together with the American College of Nurse Midwives, Avenir Health, Banyan Global, Broad Branch Associates, Insight Health Advisors, the IRIS Group, Population Services International, and the William Davidson Institute at the University of Michigan. Welcome to our session on accelerating private sector engagement, what the future holds. This webinar is the fourth in our four-part series on accelerating private sector engagement in health. The previous three webinars highlighted achievements and lessons learned in health financing, stewardship, and health markets. And webinar recordings are available on the SHOPS website and via the link just sent out in this chat for those three webinars. I also want to encourage you to take a look at the project's impact infographic, some of which you can see here on the slide. The graphic highlights our performance monitoring plan results from the past 5 years of the project. You can find the full infographic on our website and also through the link provided on the chat. The graphic will be updated again in the fall when we have our final year 6 numbers. Today, we'll take a few minutes to reflect on how far we've come since 2015 when the project started and what we've achieved and what the future holds. While the project infographic shows many of our high-level results, numbers alone don't really give you a picture of the breadth of the project. So we've prepared a quick slideshow looking back on our work over the years. Let's watch. Thank you to our communications team for putting that slideshow together. It's really wonderful to see what's been accomplished over the last 5 years. So before I turn it over to our moderator for today's session, I'd like to say a few final words. I've been leading Shops Plus for close to six years, and it's been truly an amazing journey. I'm so proud of what we've accomplished, and that success is because of all the individuals from across APT and our consortium who have worked on this project. I want to thank them for their hard work in making this project successful. We also could not have implemented the project without the constant support from USAID, both in Washington and in the many countries where we've worked, who trusted us to deliver on the promise of the next generation of private sector health programming. I want to say a particular thank you to our two AORs, Lois Schaefer and Elaine Minotti, and our two technical advisors, Jasmine Beleva and Quijada, who work with us weekly and sometimes daily to support the project. And now I'd like to introduce Caroline Quijada, who will be moderating today's panels. Caroline serves as both Deputy Director and Technical Director of Shops Plus, guiding technical strategy for the project across both core and field programs. I truly could not have managed a project of this size and complexity without her. It is my pleasure to pass the microphone to Caroline.
Thanks, Susan, for the introduction and for the kind words. It's great to be with all of you today moderating this panel. So to begin, I'd like to introduce the panelists joining me today. They are Jeanna Holtz, the Shops Plus Health Financing Director with APT Associates, Mbogo Bunyi, Senior Private Sector Advisor with APT based in Kenya, Ganesan, Senior Private Sector Advisor with APT based in India, Michelle Weinberger, the Modeling and Segmentation Advisor with Avenir Health, and Emily Mangone, the Digital Health Advisor with APT Associates. Thank you all for joining me today. I was so uplifted by the highlights reel, really nice sort of look back on the last 6 years of the project. It's like walking down memory lane. So I want to start by asking each of you to do some reflecting as well. Thinking back on the last 6 years of the Shops Plus project, what stands out in your minds as a key result or even a key takeaway? Jeanna, can I start with you?
Sure, thanks. A key highlight for me as I look back on our last 6 years is the progress that we've made in engaging private providers to participate in government-sponsored health financing programs, like a national health insurance scheme. These programs drive equity by reducing financial barriers to access care. I'm proud of Shops Plus contributions to enable private providers and government counterparts to partner through contracting arrangements that aim to be sustainable for both sides and to deliver affordable products and services in the private sector. An example is Kenya, where we supported a local partner to facilitate contracting between private providers and Kenya's National Hospital Insurance Fund, or the NHIF. This included digitizing and improving the business and clinical functions of small private practices and assisting them to become accredited with the NHIF. Once that was done, we helped them submit applications for contracts with NHIF schemes. And as I look back, a reflection is that this work has really been fundamentally about a transition from paper and cash transactions that underpin service delivery today for more than 6,000 providers in Kenya and many thousands more across other countries. Our work is also about testing a more efficient business model in which a manager represents multiple providers as a single aggregated group for contracts with purchasers, and then supporting those providers to deliver services sustainably under those contracts. During this process, we also learned valuable lessons on how an intermediary, whether it's a social franchise, an association, or an NGO, can facilitate contracting at greater scale and efficiency with an expanding government-sponsored program like the NHIF.
I think it's a great takeaway, Jeanna. I think this transition, as you put it, from paper and cash to a more sort of digital and to a more insurance-based system. I think that's a great takeaway from health financing and Shops Plus. Since you mentioned Kenya, I'm going to turn to Mbogo. So Mbogo, looking back, what is your greatest takeaway?
Thanks, Caroline. For me, I think what I'm walking away with is more. And really how much more has been able to be achieved through this private sector engagement. Because what it's able to do is to tap into investments of both the public sector and the private sector to achieve more in terms of health outcomes. I think specifically about some work we did in Kenya, and with a corporate partner, that's Twinings Tea, and they were also on the reel. And in that arrangement, there was Twinings Tea, there was the tea producer, Eastern Produce Kenya, there was the local community, there was women's groups as well, and there was the public sector. And through aligning investments from all these partners, we were able to upgrade a health facility that was serving smallholder tea farmers in an area, and to be able to provide more services. We're talking about maternity delivery services so that they could deliver closer to home. We're talking about long-term family planning and such alike. And this was all made possible because people came together, and none of those individual partners could have done it on their own. And just to mention that, as I think about it as more, the corporate partner Twinings, of course, works in multiple countries, not just Kenya, and they were actually interested in a model that they can replicate in other places. Again, tapping into how more can be done through tapping to the private sector. So for me, Caroline, that's what I'm walking away with. Private sector engagement has helped get more in terms of health services, more scale, more accessibility, more sustainability, more coverage. That's what I'm going away with.
I love this concept of more, Mbogo, more, more access, more coverage, more partners. Yes. And it's a result of the diversity of the private sector actors that we partnered with. And you've got a great example with Twinings in Kenya there. Ram, let's turn to you. So reflecting back, what's a key takeaway for you?
Another takeaway is the importance of private sector in fragile states. So in an uncertain political or security context, people tend to turn to the private sector because of its wide network. And our work in Afghanistan with Shops Plus's local partner, the Afghan Social Marketing Organization, or ASMO as it's called, highlights two aspects to this. First, again, the scale of the project's results. ASMO delivered nearly 1 million CYPs, and they started from scratch in 2016 when the project began. And the key factor to the strong results was using data to drive decisions, really, from prioritizing geographies or identifying demand gaps or figuring out which new products we wanted to introduce. And the second thing here, again, is this ASMO's transformation in the last 6 years with the project support. So over the project period, ASMO's reliance on donor funding decreased by nearly 50%. And at the same time, ASMO's been playing this greater role in market shaping, market making, the key function of social marketing. So during this period, ASMO's, for example, helped shape the market by addressing restrictive social norms or expanding distribution channels and introducing new health products into the private sector. So to me, really, the private sector plays a critical role in fragile states too, and working with and strengthening capacity of local partners can help achieve significant results. That's my highlight.
Yeah, and I think, from 0 to close to 1 million in a short period of time, that's incredible. And thanks to our partner on the ground, ASMO, for helping us make that a highlight for Shops Plus. Ram, you mentioned data and how data really helped sort of guide the work that was being done. So naturally, that makes me think of Michelle. So Michelle, as you look back on the last 6 years, what's your biggest highlight?
Thanks. Yeah, and of course, probably not surprising that my highlight would be focusing on thinking about data and data use. And I think a key takeaway for me is how, at both the country and the global level, we've been able to better use data to understand markets and ultimately use that to improve how things are done. Ram highlighted a wonderful example in Afghanistan. We have lots of other country examples where data and analysis has really helped to focus and strengthen efforts. But thinking back across the project, something that comes to mind is thinking about some work we did very early on in Shops Plus, so many years ago now, around looking at the role of the private sector in serving young people. And we developed a modeling brief that looked at the role of the private sector across FP 2020 countries, specifically looking at youth. Something that's always really stood out from that brief, and I think that it's carried on going forward, is that as we dug into the data, we saw that it was really marital status more so than age that was driving patterns of private sector youth young people. So for example, we saw that unmarried young people went to the private sector at much higher rates than their married counterparts. And then among those who did go to the private sector, we saw that source looked very different. So married young people tended to go to private clinics. Married young people tended to go more to private pharmacies or shops. So yeah, so of course, you know, this brings up a whole host of different why this is true. Is it about access differences? Is it about preference differences, desire for privacy, desire for anonymous services, or different preferences? And in reality, it's probably a mix of all of these things. And, you know, a lot of the data that we have really can tell the what and not necessarily the why. But we know that even just getting that what is an important step to building markets. And so my big takeaway is over the past 6 years, I've really seen a growing appetite for using data to help tell us that what, as well as efforts to collect new data and different data that helps us also learn that why, so that we're really having the information at our fingertips of how to best grow markets.
So thank you for going back. I think it was year one when we did that youth analysis. So really sort of taking us back down memory lane. And it's a really great point about how the data can tell us the what, but we need to do additional exploratory work to better understand the why. So that's great. So I'm going to turn to Emily. Emily, to the best of your ability and trying not to be distracted by the noise, tell me what you think sort of resonates the most with you to highlight.
Great, thanks, Caroline. So when I reflect back on the impact that Shops Plus has made and the lessons that we've learned from a digital health perspective, what I think of is not one mobile application or one digital innovation, but instead how the overall success of our project was really facilitated by integrated user-driven digital approaches. So, for example, one achievement that I know we're very proud of is how we've reached more than 40 million people with health messages. And many of those were through targeted social media campaigns. We had a very effective artificial intelligence powered chatbot in India. We set up multiple WhatsApp groups, sent out hundreds of thousands of text messages, and set up several on-demand interactive voice response systems. So we really selected digital channels that could broadly reach our target populations, including women and adolescents, and sort of reinforce those actionable health messages. On the supply side, we really improved equitable access to essential health products by introducing digital tools that improve the efficiency and quality of the delivery of health products and services through the private sector. So again, one example is in Nigeria, we introduced TV Star, which is a mobile application for screening, referral, and follow-up for TB patients by health providers at drug shops, clinics, hospitals, labs. And it really is a tool intended to help providers diagnose and connect their patients to treatment and reduce that loss to follow-up. I think another notable highlight of our project is how our activities embodied the principles for digital development. And one principle that I would like to highlight was our commitment to designing with the user. So all of our digital solutions were driven by user needs and co-developed in direct collaboration with the intended users, which was really a fun process also working with those users. So I think over the past 6 years, we've really seen increased demand for supportive digital technology in the private health sector. And we saw this demand surge during the pandemic, of course, for everything from clinical training to health payments to data collection. So when I think back, I'm really proud to see that Shops Plus facilitated the introduction and scale of some of these responsive digital technologies. And I'm excited to see the next generation of innovation at the intersection of private sector health and technology.
Thank you, Emily. I think that's great. I think digital certainly has been something for us to look back on and reflect on. I think it's been great to have us all look back. We've talked about health financing, we've talked about digital, we've talked about fragile states, a lot of really great learnings and takeaways. Apologies. Thank you for your patience and understanding. It does sound much better. It's very quiet. So I think I'm just going to take a step back just so I can regroup as moderator. And I'm going to go back to the question that I asked previously. And Emily, I would appreciate it if you would repeat your response with regards to working with local organizations. So both you and Ram mentioned working and partnering with local organizations, you on the digital front, Ram with a group like ASMO. So what were those learnings, and what would you like to sort of share in terms of a reflection in terms of working with the local group?
Great. So to repeat some of the points that I made earlier, I think one of the things we've learned is in working with those local partners is that there's a lot of great capacity in terms of information and communication technology and potential for innovation. So in those countries in which we work. So we worked with some great startups. We saw that creative energy. And an example that I had mentioned was that in Nigeria, there's a really great tech sector, a lot of startups, and Shops Plus really benefited from that talent and sort of the local insight. So when we're building our products and our innovations, we really benefited from their insights about the enabling environment there. And we see now that sort of as Shops Plus is closing down, that these tech firms are really well placed to provide sort of that continuous support between project cycles, and as we transition more of that work to those local innovators and to locally led initiatives. So again, my key takeaway is let's invest in those local innovators, and we'll have a more sustainable impact.
Yeah, and I think Mbogo, you wanted to add something as well.
Yeah.
But I love that point, Emily, about really continuing to work with those local innovators and entrepreneurs. So Mbogo, please, the floor is yours.
Thank you, Caroline. I also get asked the question a lot about how do you identify local partners to work with, and how do you know who to work with? And for me, I've seen the importance of networking. And look, if you're going to work with the private sector, it is necessary and important to be where the private sector is, like in their spaces, because they do have spaces and efforts to meet to address the challenges that they may be looking at or see how to partner and to connect. And as I look back, an example of how we're able to leverage this was our policy change work in Rwanda. So in Rwanda, we worked with them. We were able to leverage an association, a professional association that is Association of Pharmacists and Pharmacy Owners of Rwanda. And we worked with them to be able to advocate for policy change so that pharmacists can be able to administer injectable intramuscular family planning. So, and how did we connect? We found each other at a regional private sector association meeting. That's the East Africa Healthcare Federation meeting. And at that meeting, we had gone to present the concept. We had an advocacy toolkit we had developed, and we're looking for, who would be willing to work on this to carry on this advocacy further. And so, going to the regional association meeting where they were at and identifying people we could work with, that's where the journey began, up to this final result of more access, like I've been talking about earlier, through pharmacies and through trained pharmacies. So for me, it's about the importance of networking at the places where the private sector is. That's what I wanted to add.
Thank you, Mbogo. Great point.
Yeah.
Does anyone else want to add another learning or another point about working with local organizations?
I'd say being partner-led, Caroline. Our local partners were at the helm of strengthening their own capacity from the needs assessment stage to prioritizing strategies and then actually how the technical assistance was being provided. So the fact that this approach, it enhanced the buy-in and therefore then the sustainability of the organizational development efforts that we instituted.
Yeah, that's another great point. So meet the private sector where they are and let them lead. I think those are two great sort of takeaways about working with local organizations. Thank you both. One of our mandates on Shops Plus was to support private sector initiatives and approaches at scale. So were there challenges to achieving scale? And if so, how did you overcome those?
Caroline, this is Jeanna. Maybe I can take a stab.
Mm-hmm.
Well, I think a key to scaling up private sector approaches is working with governments through public-private partnerships. This is certainly true when I think about increasing private sector participation in financing programs that have the potential to increase access and to reduce financial barriers for large numbers of people. One of the challenges, and certainly they exist, is to achieve scale is that public and private actors often don't know each other well. Often they hold misperceptions, sometimes negative ones about each other. And in our work, we found that it does take time and resources, but nonetheless, it's really critical to convene public and private actors early and often. It's through this dialogue that they'll develop understanding, mutual respect, and often a real bonus is that we see champions who emerge and who will drive these initiatives forward. So I'll highlight our work in Senegal, where we were facilitating contracting. Shops Plus began by enlisting senior leaders from the Ministry of Health and the National Association of Private Providers to establish a framework agreement for contracting between private providers and health financing schemes called mutuelles that the government is supporting to scale up. It was during these high-level talks that champions from both the government and the private association became visible advocates for more public-private contracting. These were respected leaders who were instrumental in building trust and accountability by promoting the principles of this national agreement, but also just by showing up and participating in local meetings with people who were implementing a pilot for contracting in 3 districts. And now it's these champions who are leading the charge to expand contracting with mutuelles across the country.
So Ram, I'm pretty sure you have probably some more scale examples just to add to Jeanna's Senegal. So I'm gonna actually call on you. Do you want to share some challenges or some successes of working at scale?
Sure. So leveraging existing networks, both health and non-health, I feel has really helped us during this project in reaching scale. For example, working with third-party distributors to make sure that the products reach their networks of thousands of retail outlets or whatever, or forging a partnership with MTV to reach millions of people through a TV and a radio serial drama. And also non-health networks like we worked with beauty salons, network of about 10,000 beauty salons, or a network of 100,000 mosques to provide health information and counseling. So all of these networks have really helped sort of scale up or bring the intervention to scale. But at the same time, I think there's a quality to the scale too. What is the scale among the underserved? And the corporate partnerships, like the twining example that Mbogo just mentioned maybe 15 minutes back, I think it helps take the intervention to those remote areas and scale up there. And other partnership with other agribusiness firms that we've done in India have also been very similar in terms of both their longevity and the scale. I think task sharing is another example, or enabling an additional cadre of health workers to provide services, so that the services provided in new areas and potentially at a lower cost. The CRS's Sangini network, our partner in Nepal, their network of pharmacies for providing injectable contraceptives. It's a great example. It's about 3,000 or 4,000 providers in small towns and peri-urban areas. And of course, engaging drought shops for TB screening in Nigeria is another example. So these are the various ways in which I feel we've really hit scale.
Caroline, if I may very quickly, I know we got a small interruption. But, yes. So Drug shops, Tanzania, an example of scale of what we did in Tanzania. We worked with ADOS, that's accredited drug dispensing outlets, to strengthen. There are about 10,000, work closely in the community, first point of call for healthcare, and work with them to build their business and management skills, and then passed that into a national curriculum that can make it then be sustainable and continue further, and pass it on to the associations. So yes, that's my pitch for scale and sustainability from East Africa. Thank you.
Thanks. Thank you. Michelle, I'd love to sort of give you a moment to address that scale question. And also there's been a request, if you wouldn't mind repeating your point about unmarried and married and private sector from the earlier question, if you could just repeat that so that it can be.
Yes. Yeah, so on the youth, and I put the link to the brief again in there, was that we see that patterns tend to be more driven by marital status than by age. So we see unmarried youth going to the private sector at much higher rates than their married counterparts. And then even among those youth who do access the private sector, the sources tend to vary. So married young people who are going to the private sector are going more to private clinics, where unmarried young people are tending to go more to private pharmacies. A whole host of reasons sitting behind why those patterns exist. So in terms of scale, I think I'll take this from a different perspective, because my work sort of sits more at this global level than the work my colleagues have talked about sort of in countries. And something that's worked well to kind of scale things in terms of data is by developing tools that are pre-populated with data for lots and lots of different countries. So two quick examples of this are the private sector counts, which has data from all the USAID priority countries and Ouagadougou partnership countries, and lets you look at the role of the private sector for both child health and family planning. And then the FP Market Analyzer tool, which lets you explore these sort of future what if scenarios. And that's pre-populated with data for nearly 60 countries. So every country with a somewhat recent DHS has been included. And so by making this data easily available for a wide number of countries, sort of brings these analytics and brings this type of analysis to a wide audience.
Thank you, Michelle. I want to thank all of the participants. Thank you for your patience. Thanks for your flexibility and your ability to continue talking, even though there was a lot of distracting noise. Thank you very much. All your hard efforts certainly are being reflected in your thoughts today and in that highlights reel. I want to quickly move on, and I want to sort of turn to the future. I want to go ahead and invite my three special guests this morning to join me, and we're going to speak a little bit about future directions of private sector engagement and some thoughts on future forward-thinking topics. So I will be introducing my three panelists for the second portion. The first is Anand Sinha. Anand is the country advisor for the David and Lucile Packard Foundation in India. He has over 20 years of reproductive, maternal, and child health experience, and he has led some of India's most successful market-building initiatives for contraceptive products. Welcome, Anand. Chang-Hee Huang is Family Planning 2030's Director for Country Engagement and Transition, and plays a key role in leveraging the strong relationships with country governments and partners for the development of the next generation of rights-based, data-driven family planning commitments. And also with the goal of enhancing the reproductive health and rights of women and girls. And finally, welcome Chang-Hee, and finally Kuyosh Kadirov, who is a senior technical advisor for private sector at USAID and part of the SHOPS Plus AOR team. He is a public health expert with 20 plus years of experience in international development, implementing health programs that engage both the public and private sector to deliver quality and affordable products and services. So thank you to all three of you. I realize we're a little bit short of time. We had some technical glitches this morning, but I still hope to have a full discussion with you. So looking towards the future, I'm going to start with the first question, which is, where do you see efforts on engaging the private sector in health moving towards in the future? So, where are we going with private sector engagement? And I'd love for your answers to be sort of focused on with respect to increasing access to family planning. So Anand, why don't we start with you?
After listening to that panel, I actually think the future is here, by the way. But thinking beyond that, um, I guess, a couple of thoughts. One is that we have to recognize where we've come from. And I think there's been a long journey that we have made in terms of sort of private sector evolution and innovation and engagement with reproductive health and family planning. And there's been a ton of innovation, and it's been very breakneck speed as well. But I think the future is going to be more towards strategic partnerships, frankly. I think we've seen a lot of, where we've come from has been about how do we sort of, enhance private sector resources, commitments, how do we leverage private sector expertise even and bring that into sort of the health sector. But I think we're going to go more into sort of the area of, I hope it will be more about sort of strategic partnerships where it is about the private sector becoming, part of the journey whole soul as entities, and seeing it as sort of part of their mission and how it sort of serves their purposes. I think that's sort of, the holy grail that we are constantly searching for. And I guess, I hope also that, the private sector will, over the next couple of years, become a little less shy about reproductive health and about family planning. And as we see more sort of, norm changing, I think, work happening, the environment for engagement in family planning will improve.
Great, thank you. I love this concept of bringing them along, having them be part of the journey, and really focus more on the strategic side of partnerships, and not just seeing private sector as a source of resource of funding, for example. Quijada, your thoughts?
Sure. Hi, everyone. And first of all, thank you, Caroline and the Shops Plus team for this wonderful webinar. And Caroline and team, you guys did an amazing job of handling the curveball that just came your way. And apologies for that. And thanks for getting us back on track. Agree with everything that Anand said. As voluntary family planning use continues to grow, we need to continue forge ahead with supporting the private sector, both nonprofit and for-profit actors, engage them in family planning provision in order to continue to improve equitable access, ensure availability, promote consumer choice, and to continue to strengthen the quality of care. And so all countries can be looking for these opportunities and creating conditions that are favorable for private sector participation. It may take some time in some settings, but eventually countries tend to move towards more mixed health systems and encouraging greater participation from the private sector in service delivery. And so, as many things that have been already mentioned by the Shops Plus team, we believe that it's important that we continue supporting the efforts that our country governments do in order to strengthen their health market systems, in order to harness the potential of the local private sector. And so we see a lot of opportunities in family planning market intelligent platforms, locally led, sustainable, market-based solutions that really help us fuel the commercial activity while also helping the donor and public sector with much needed timely visibility to the local private sector actors and how they are contributing to the health outcomes. And also, we also need to make sure that there are market facilitation platforms that really help us translate market insights into actionable policy and investment decisions, but also help stimulate public-private dialogue, bring private sector voice, improve strategic coordination. The role of the public and donor financing, we cannot underestimate that. We need private sector with being included in these strategies without being nudged to do so, and increasing access to various forms of capital that meets the needs of the local private sector players, especially micro and small enterprises that make up the core, right? And of course, removing some of the regulatory barriers, reducing transaction costs that really hinder and prevent the local private sector from expanding their reach and offerings, their capability to invest, and their confidence to invest, and also, more importantly, joining the formal sector. And so we have a lot of practical and impactful approaches in our arsenal: social marketing, TMA, social franchising. And these practices really helped us to grow and strengthen the family planning markets over the decades. And so we really like to see more efforts to help institutionalize these practices and other market development efforts with our in-country implementing partners on the lead.
Thanks, Quijada. I think you're raising government partners and country partners is a nice segue for Chonghee. So Chonghee, would you like to share your thoughts on what the future is for private sector engagement?
Sure. Thank you, Caroline. And I also feel this is such a privilege for me to join today's webinar along with the two strong panelists. So looking beyond the public sector can significantly expand the reach and effectiveness of a national family planning strategy and frameworks, as Dr. Anand and Piyush also mentioned already. The private sector partners has played a significant role in delivering family planning services and products and informations, as well as contributing to diversifying resources at various levels. And looking more at the global or regional and country level, so private sector will continue to be a key partners in family planning 2030 partnership as well. So as you may know, the EP 2030 commitment making process of both country governments and non-government partners is currently ongoing. Engaging the private sector in the country government's commitment process has been one of the key interested areas for many countries. And specific guidance for how to engage with those various private sector partners throughout the EP 2030 commitment process has been developed in collaboration with the Shops Plus and will be publicly available in the coming days. And also not only as a supporter to countries to realizing and personalize those commitments, but as a commitment makers, several non-governmental partners have submitted their new commitments to EP 2030 to date. So we are eagerly hoping for more commitments from non-governments, especially private sector partners, to broaden the scope of the partnership in the next decade.
Thanks, Chonghee. And it's great to see FP 2030's focus on private sector. And we were happy as Shops Plus to participate in the development of the private sector guidance for the country platform. So we look forward to having that released soon. I see Anand has a point he wants to make. Anand, please.
Sorry, I did see a question in there about incentives, and I'm thinking one of the things I'd like to see in the future is to have profit not being an evil word anymore. I think if we can see that change, that would be one of those huge sort of, getting the incentives right for improving access to healthcare and with the private sector.
I think that might still be a little bit of a long road, but yeah, I'm with you on that goal, Anand. Okay, so Emily, and if you were with us earlier, Emily shared a lot of results from the digital technology side of Shops Plus. And I think one of the things that we can all agree on is that digital has been a game changer. Digital technologies have been a major game changer in the last 5 to 10 years. And particularly its role was cemented during the COVID-19 pandemic. It helped us continue to access healthcare without leaving our homes. And all sorts of, daily routine functions continued because of the power of digital technology. So let's look towards the future. Beyond digital technology, what do you think are future game changers? So Piyush, I'm going to start with you.
Sure. Thank you, Caroline. I think the potential that the digital health and platforms have to offer is enormous. But looking into the future and just being specific about one element of it, I think we're continuing to leverage the potential of the social media as a means to continue to work on social and behavior change communication, for instance, in a very cost-effective ways, reaching larger populations or targeting specific behaviors. And doing so, it's really helping us to increase our efforts in communication and raising awareness, addressing misconceptions, and support normative changes around gender, contraceptive use, self-care, but also helping us to gather some valuable insights into the preferences of family planning users that really help us improve our programming decisions. Of course, there are concerns around quality of the information and the deepness of the online engagement that we need to continue to learn and improve upon. But social media has been an amazing platform to really help us boost our social behavior change communication efforts.
Yeah, I agree. I don't think we've leveraged social media to the extent that we can yet. And so it's exciting to see what we'll be able to do moving forward. Anand, what are your thoughts on game changers?
I think I think just sort of looking at what's happening with technology, but also looking at what's happened with COVID, and maybe it's particular to the Indian sort of context, but so access to services, healthcare services, has transformed significantly in the last 1 year. A lot of it is because of the open, what is happening with respect to technology platforms, e-commerce available, accessing doctors and health services online. And COVID has, sort of just, sharpened that edge, right? So the way we seek health services and health products for a large proportion of the population in places like India, and I'm not talking about the digital divide, but for those who do have access, has changed and has changed permanently. And so this is, clearly, I think, sort of laying out what's going to be happening in the future. But what it spells is an opportunity to demedicalize. I think an opportunity to put more power into the hands of clients, into the hands of consumers, and maybe sort of, see greater sort of, participation of clients in that self-care or in that care-seeking process in itself. I think that's not going to go back anywhere, and it's only the way forward.
Yeah, yes, definitely the demedicalization of family planning and with the emergence of self-care products. I think that's a great point on it. Jong-hee?
It's just adding to what Dr. Anand mentioned about when there are short-term and longer-term perspective that we need to look at game changers. So one of the longer-term, the game changer we can think of is like research and development of the new innovative contraceptives should be continuously explored as a longer-term perspective. But as Dr. Anand mentioned, there are some like a shorter term or mid-term or low-hanging fruit that we can think of. Self-care is the one thing Dr. Anand mentions, and we need to make sure that health systems would optimize those self-care approach through a systematic approach to ensure safety and quality of care in our mind. And the other thing is like adding to the digital platform that many countries are using more than before since the pandemic. The artificial intelligence technology has been more adapted in many countries as well since the pandemic, especially in manufacturing and forecasting of commodities and data collection and counseling of family planning in the influx of the service availability and also healthcare workers at different levels.
Yeah, I think R&D in the future is definitely something to look forward to as well. Great points. Thank you, Jong-hee. I want to quickly turn to if I can squeeze one last question in before the top of the hour, and I'm going to ask each of you to give me some short responses. And this question probably is a little bit tough, but we'll go ahead and try it anyway. But really is I want to talk about climate change for a second. So climate change is an increasing area of focus globally. We hear about it. We're all sweating in DC. Death Valley is 134 degrees. So how does climate change help shape future private sector family planning programming? What does that intersect? What do we need to be thinking about in the future? Who would like to start? Jong-hee, I think I've had you go last twice. So why don't we start with you?
Thanks, Caroline. So AP 2030 has been talking a lot about this intersection of the climate change and family planning, because improving access to voluntary right-based family planning is not only good for enabling women and girls to space their children, excuse me, and prevent unwanted pregnancies, but also is critical to biodiversity conservation efforts by taking pressure off local environments, reducing their vulnerability to the impacts of the climate change and building their resilience. So this makes a joint conversation among the conservation and sustainable resource management and also right-based family planning program as a win-win, and also work to combine family planning with sustainable livelihood has been strengthened through public health environment programs, which has been spearheaded by several private sector partners and organizations, including Margaret Pike Trust and Blue Ventures and other NGOs. So the range of private sector's intervention is fairly wide, and that includes a combined community training and increasing access to family planning services for communities, living, especially those ones are living in the remote areas of high biodiversity.
Anand, quickly.
So a slightly contrarian view and a risk to climate change focus is that it tends to put people as a denominator. Population suddenly becomes a denominator, and suddenly family planning becomes about population control because there's stress on the environment and there's too many people, so we need to reduce the numbers. And that suddenly undoes everything that family planning has been about, right? So there is a risk to sort of seeing where that is. Having said that, I think it's something that we really do need to figure out where it lies as an opportunity, because it is an opportunity for us. And I think one of the big opportunities is the fact that it is about listening to communities, and it's essentially about sort of, again, the transfer of power and that sort of representation of communities, and looking at the intersectionalities that need to exist where family planning, reproductive health is part of a broader sort of sustainable world in the future.
And there's a comment in the chat about sustainable programming is where we should be focusing on, which I think sort of leads to where you were headed. Kuyosh, quickly, one last word for you and
sure.
Before we close.
I think we are witnessing the effects of climate change on a regular basis, and climate-related shocks undermine and impact FP delivery systems, and we all agree on that. And so I think we need to continue our work leveraging the private sector for access, availability, and we need to do that in a way that we're helping build the resilience of market systems with all the, with the work around improving all the market functions that I mentioned earlier. But I think it's even more important that we do this by working with local partners, those who are on the ground and help us lead, develop, implement, and share best practices, tools, and learning so that we're helping to improve the resilience of the systems that we have. And so we need to continue our efforts, improve, help support the resilience of market systems, and empower local private sector and help institutionalize some of the practices we know impactful, and that will help us mitigate and also withstand some of the climate change shocks that we are experiencing.
Thank you very much. I'm so sorry that our conversation had to be cut short because of our technical difficulties, but I thank you all for joining us today. Thank you very much for your time and your thoughts. There's a lot of great comments in the chat that we'll be sure to address and keep in the notes. I want to thank everyone who participated today. And to close our session, I'd like to ask Elizabeth Corley, our Director of Communications for Shops Plus. Elizabeth and her team were instrumental in making our end of project webinar series a success. And so thank you. And Elizabeth, the floor is yours.
Hey, thanks. Thanks, Caroline. This concludes our webinar series, but not our dissemination of lessons on private sector engagement. There's much more to come. We have, for example, 2 briefs coming, one on health market development and another one on corporate engagement coming out this fall. Visit our website to get more information and the latest on private sector engagement in health. That's at shopsplusproject.org. Thank you.